What is botulism?
Botulism is a disease caused by a bacterial organism called Clostridium botulinum. It produces many toxins, 8 different toxins. It is a spore-forming anaerobic bacterium, and anaerobic just means that it enjoys growing and living in low oxygen tension environments, deep in a puncture wound or other areas similar to that.
Where is it present?
Within kind of the generic, it's ubiquitous in nature or throughout the country. They're kind of hotspots and kind of endemic areas. Here in central Kentucky happens to be a particular hotspot or endemic area.
How does it affect horses?
The horses contact botulism in one of 3 ways. They'll either ingest the spore, and this is most common in foals, kind of the Shaker foal syndrome. The other is they'll ingest preformed toxin, and this would be hay spoilage, improperly ensiled haylage or baylage. And the third is through wound, and this typically would be a negative sequelae to castration or umbilical hernia repair or a deep puncture wound. So those are 3 ways that horses commonly come in contact with botulism. The botulism toxin is the most potent toxin that we know, and the toxin basically interrupts the transmission of normal nerve impulses. So a horse will signal to pick up or move its leg. The stimulus comes from the brain down through the leg, and when it reaches to the level of the synapse, acetylcholine is released. It goes across to the other end of the motor plate junction, and the horse then responds to do what he's supposed to do. The botulism toxin keeps acetylcholine from being released at those end plates.
What are some of the clinical signs?
So we'll break it off into 2 groups. We'll start with the foals. Foals typically, the group that it affects are the best doing foals, ones that are really thriving, growing well, really up in the feed tub and doing quite well. I'll get a call saying the foal is down, weak, unable to rise or stand. And when you show up, it'll be a foal that after you make him get up will be really shaky and muscles will be trembling, kind of full body fasciculations when he lays down and stands up, hence the name Shaker foal syndrome. And adult horses, they'll typically present a number of ways. Sometimes it'll start as colic. People will call and say, hey, my horse is colicky. Often I'll get a phone call saying, hey, my horse is choking. And when you get there, and it's probably not so much a choke as it is the horse is having trouble swallowing, and dysphagia. So those are typically the common onset of the disease. It is a very progressive disease, and depending on how much toxin they've been exposed to or come in contact with or have ingested, is kind of where they are in the disease progression. The more toxin, the worse they are typically. The least or the less dose that they've been exposed to, then certainly the other end of the spectrum that they are. It is a progressive disease without treatment, and will ultimately result in paralysis of the muscles responsible for respiration, and would lead to an untimely death.
What does treatment consist of?
Treatment consists of a few things. First and foremost, remove the offending feed stuff if that's how the horse became exposed. The second would be antitoxin. And the antitoxin binds the remaining circulating toxin in their system and keeps it from being able to bind to the synapses and affecting neurotransmission. The third is good clinical nursing care, good nursing care. Nursing care would consist of providing IV fluids, parental and enteral nutrition, if you could provide enteral nutrition, and just good nursing care. Some horses, if they progress far enough in the disease to a down horse, they may need to be slung and brought into a standing position a few times a day, rotated from side to side, and just good round-the-clock nursing care.
What's the outcome on many of these cases?
It depends on the amount of toxin that the horse has ingested or come in contact with and how far along into the progression of the disease they are. The earlier in the progression of the disease, pretty good chance of outcome with proper nursing care and proper anti-toxin therapy. Those horses will usually recover within 7 to 10 days, barring no unforeseen complications. Without treatment, the progression to death is usually pretty inevitable. So with good nursing care, good anti-endotoxin care, horses have a pretty good chance of survival.
How can it be prevented?
The disease can be prevented in a couple of ways. First is provide your horse with a quality feedstuff. Hay free from mold or spoilage, baylage or haylage free from the toxin, or haylage or baylage that has been ensiled properly. And probably the most important part of prevention, or aspect of prevention, is the vaccination process. We start foals off at 3 to 4 months of age, and they'll have a 3-shot series. Similar in adults, as long as they're boosted once a year, the vaccine is very beneficial. The vaccine is against the botulinum toxoid B, type B, and that, like we talked about earlier, accounts for about 75 to 80% of the clinical cases in horses. And if properly immunized with the vaccine, it's 100% efficacious. So we haven't seen any breakdowns or failures of the vaccine in properly immunized horses.
Are there any specific populations of horses that should definitely be vaccinated?
Sure. Horses, broodmares especially, transferring that passive immunity onto the foals are definitely a population of horses that need to be vaccinated. Foals, similarly, I mean, they're, especially when you talk about your best doing foal, maybe the one who's very likely to get sick is the very one that you want to try to prevent the disease in. So we often talk about interference with maternal antibodies and vaccinating foals too early, and this seems to be the exception. Vaccinating foals with botulism toxoid doesn't seem to interfere with maternal antibodies, so we can do it at an earlier age. So we start at 3 or 4 months of age. So all foals probably should be vaccinated. And essentially, it's horses in those endemic areas are eating feedstuffs that would be particularly predisposed to having some spoilage. Those are definitely candidates for it as well. So you can kind of go through and do this this risk assessment factors, and the horses on the higher end of the risk assessment, surely those are the ones that need to be vaccinated. It's not considered a core vaccine, but honestly it probably should be if you can prevent the disease with the vaccine.
Great. Thanks very much, Dr. Mason.